I hope you enjoy this review of our year, 2020 to 2021. In many ways it's been a difficult year, not just for us but for the country as a whole, in dealing with the further problems that the coronavirus pandemic presented to us. What it gave was an opportunity for us to work closely together with our partners, our patients, their families and carers, and our staff in driving forward and driving up excellence and improving our services. I hope you find it as exciting as we do.
Our school nursing service launched a new text messaging service, Chat Health, for 11 to 19-year-olds. The service is a quick and easy way for parents with school-age children to get help, advice and support about their child's physical, mental and emotional well-being. Chat Health had already been running for parents of 0 to 5-year-olds, so the expansion of the service is a reflection of the success it's been with parents. Our children's service also undertook an extensive flu immunisation programme, reaching almost 100,000 pupils across 590 schools. The Trust launched and led an international research effort into the effects of COVID-19. The findings of this research helped to inform the World Health Organization strategy and is informing the way we respond to the mental health implications of the pandemic on our society. The study will finish at the end of September 2021, with over 150,000 people having already taken part. In September 2020, we opened Ashford, a purpose-built 10-bedded ward specifically for adult men with a learning disability who have been detained under the Mental Health Act. With a multidisciplinary team of nurses, support workers, occupational therapists, speech and language therapists, social workers, psychologists and psychiatrists, Ashford provides a safe, secure and patient-focused environment. In November, Southern Health's Learning Disability team celebrated after 2 of its service user-led groups were shortlisted at the National Service User Awards in the Breaking Down Barriers category. Jordan, who was supported by the Trust's North Hampshire Community Learning Disability team, won for his work talking to and educating paramedics, GPs and other healthcare professionals about living with learning disabilities, tailoring healthcare services and how to improve hospital appointments for people who may struggle with them. In November, we were delighted to announce that the Frailty Admission Avoidance team were shortlisted in the Primary Care, GP or Community Initiative of the Year category at the HSJ Awards. The team works to support people with frailty from being admitted to hospital by supporting them at home, identifying support needs and enabling them to regain independence. In February, we announced our plans to develop 2 new mental health wards for Southampton and Basingstoke, totalling 28 beds, dedicated to supporting some of the most vulnerable women in Hampshire. Both wards will provide much-needed mental health provision to women in crisis, preventing the need for treatment to be provided further afield. Patients have been closely involved in helping to design and name the new wards. Following its completion later in the year, the newly completed ward in Basingstoke, Cherry Ward, was featured on ITV. Throughout the year, we continued our partnership work with Unlock despite the impact of COVID-19, which meant that we were not able to deliver workshops in schools and colleges. However, we adapted and introduced innovative ways to continue this work, including bespoke mental health and well-being online courses free for all students to access. Our youth board provided workshops and webinars on mental health awareness, including this one in March on autism and mental health awareness, which also raised money for our charity Bright Away. In 2021 and 22, we hope to introduce youth members to our full board. And not forgetting all the incredible efforts of our staff who have risen to meet the challenge of COVID-19 during the last year. Thank you.